Next thing we want to do is spend some time going over what we learned from those that were involved in the Freeman High School active shooter incident. So we have a panel that we're going to have to provide their individual perspectives on things that they've learned and lessons learned, and then we'll hopefully have an opportunity to ask questions. So our panel is going to consist of Simone Ramel McKay, Program Specialist for Greater Spokane Emergency Management, Eric Abner, who is the Director of Clinical Operations of Multicare Deaconess Hospital. She also is our DMCC coordinator. Adam Richards is the Director of Emergency Services for Urban Campuses of Providence. Daryl Ruby is Emergency Management Manager of Providence Healthcare, both I think stationed at Sacred Heart. And Jan Dobbs is the Chief Operating Officer of Frontier Behavioral Health. And they've all will bring some great perspective and some insight into our role as a healthcare coalition and the response that we have, the coalition has played.
I'll use this, pass it on. I do need that. Great. Thank you. Okay. Thank you all. I am going to start. My name is Simone. I'm going to start just and give an overview. And I'm going to tell a little bit, just briefly, about who we are. But it has to do with the incident. You'll see why I am mentioning this. So you can read this, but what I want to point out, if I can, oh, does it have a pointer? Well, oh, there it is. I see it. I want you to see major emergencies and disasters. Coordinating agency for during major emergencies and disasters. Just keep that in mind. We do a lot of different things. We have a duty officer 24/7, and that's something I'd like you to remember as well. One of our greatest roles is coordinating and facilitating response in major emergencies and disasters. So we do a lot more than that, but that's not the point of this discussion, but I want you just to keep that in mind. So basically on Wednesday, September 13th, there was a shooting, and there was very quick response by fire and law enforcement, thankfully, and also by school staff, teachers, and maintenance personnel. So in a very short time, at least according to law enforcement, the sheriff's office had secured the scene. Sometimes that can take a whole day, and they felt they would have liked to do it faster, but still they felt it was fairly quick, given, and I want everyone to think about this too, that this was the first time our region has had a fatality. We've had threats. I'm not going to say that there haven't been threats, but a fatality and injuries surrounding a school shooting. And the reason that's important to remember is that the response was, I believe, and this is my personal opinion, I'm not speaking for my agency, but my personal opinion was far more emotional even for first responders. Many of them had children at the high school. Washington State Patrol did Fire District 8 did, law enforcement from Sheriff's Office did. And so the impact, I don't even think, and I wanted to talk with a few of them about that, and I haven't yet. I don't think they were prepared for how emotional it was going to be for them personally. The extended response on all of the healthcare side was quite good. There were a lot of things happening. What I wanted to point out, let's see if I can find this here. I made a couple notes about these timelines. There are a couple things that didn't happen. Now, what I want to say is that I think there was an incredible amount of response and good work done on everybody's part. I ended up being there for about almost 2 weeks. and working 12 to 14-hour days the first week because there was so much to do. And the reason I pointed out major emergencies and disasters is because the first responders did not quite see this as a major emergency or disaster in the same way as we usually do. In emergency management, it's usually you see fire, law, utilities, you have all these people needing to respond. They didn't realize, well, Freeman is its own jurisdiction. They think of the city of Spokane as a jurisdiction, you know, city of Spokane Valley, county as a jurisdiction. And they didn't think of the school as its own jurisdiction. And that's nobody's fault. It's because we haven't had this happen before. So just some stuff to keep in mind, because nothing was perfect. We also had a lot of people who self-deployed. That in this instance, it was 3 groups that had a lot of experience in school shootings. Their intentions were great. They had a lot of good information to provide. The failure was they didn't connect with the local agencies. They didn't connect with us. They didn't connect with some of you. And our agency faltered. I'll be quite honest. We faltered a little, not knowing how do we do this when somebody else has already come in and we're not brought to the table. It's a challenge. And our AAR with the whole first responders was quite good and showed us now what we need to do going forward. The only point I want to make here on this extended timeline is that one victim was arriving at the hospital, is what you were told. However, this was not the case. Well, it was because the landing zone was being used by Border Patrol, and so Life Flight couldn't land. And I think that was the oh, and the only other thing I wanted to point out was the injuries. They were not related to the shooting, but they were related to the incident. So I think that's important to point out. The 2 other injuries were related to the trauma of the incident, not the shooting itself. So, so lastly, I wanted to share that we had a woman who came from another school, had a lot of tremendous experience at Marysville, and brought some good support to Freeman superintendents and their administrative staff. We had another woman from the Crisis Management Institute who had worked with the woman from Marysville, and she brought in a gentleman from Gallatin Communications who was also quite good, but he's on the board of the Empire Health Foundation, so he hooked in the Empire Health Foundation to help with all the response. What they trying to be so helpful, and they did, they were extremely helpful, again, left out a lot of local partners, and you will hear more about that from the panel. So I will pass it on, but does anyone have any questions? I know that I gave you a little mishmash of things there. Anyone have a question? Okay, I'll pass it on.
I'm going to stand up just because I'm short. My name is Erica Abnor. I am the Director of Clinical Operations at Deaconess Hospital. I also took ownership of the Disaster Medical Coordination Center because someone needed to. And what happened on that morning, I happened to be at a meeting and we had EMS personnel coming in, bringing in other patients, and staff started hearing them talking about an active shooter. So I received a text message and ran over to the ER. Shortly after I got to the ER, we actually got the phone call from the CCC that there was an active shooter. You know, and looking back at the timeline, we were notified quite, a little bit after things had already started in motion. At first it was in my head, we had heard that there was 3 patients, and that, had heard that some were coming to Deaconess, and then we heard, no, they're all going to Sacred Heart. We had heard that all the patients were being transported, and at first I didn't know whether or not I should even activate the DMCC, because really, while it was a very tragic thing, we were told there weren't very many victims. But, activating the DMCC was something, that's our responsibility to do. First of all, just to make sure that we can share that situational awareness with all of our healthcare partners, but also to establish communication in the command center chat room. So after I took that phone call, there was a notification that went out, a roll call over the HEAR radio, just to do an initial announcement of the incident, then went into our DMCC room, got on WaTrack, typed up an alert, sent an alert out. One of the learning opportunities there, when I was sending the alert, is that I didn't use the template. I think I was just trying to get information out. We do have wonderful templates that are put together that make sure to include all the information that we need to send out. But I did send an alert. I also opened up the command center so that we could communicate with other hospitals, hopefully with the scene. So I thought, the communication was great. I was excited that we used the tools that were available to us, which was basically following the DMCC concept of operations, which outlines our process, and using the command center for communication of situational awareness. Some of the other opportunities, there were some folks missing from communication in the command center. And one of the other barriers that we had was, I got the initial phone call, but after that didn't receive any more communication. And one of the biggest challenges is that we were getting, different reports from different EMS personnel coming in that there was a second shooter, that there were more victims. So I was really glad that we were called, we were activated, just in case we did need to send patients elsewhere. We had pretty good communication from Kootenai Valley. It sounded like everyone kind of had an OR on standby in case needed. So we were all ready if need be. All the patients did end up going to Sacred Heart because they were pediatric patients. Us too at Deaconess, one of the difficult things in having to run the DMCC is that I was also getting phone calls that I had employees that were impacted, in this event. So I was sending our executive team who were with me downstairs, but I was having to send them to those employees who were actually working in the hospital. It's really hard when you have something like that happens this close to home, because you're going to know somebody who was affected by it. I decided to remain activated just to make sure there were no other needs, no other patients. Reached out to Mike Lopez, a couple of other people, just to make sure that the scene was in fact clear, because we were getting different sets of information about the patients and the number of shooters. But while we do have lots of opportunities with respect to the alert and communication in the command center, it was pretty exciting to have a process ready for something horrible like this that did happen. We had a process to use, we had tools to use, and we did use them. So, and we stood down probably a little bit after 4 o'clock in the evening, after we made sure that there were no other needs throughout the region or from Sacred Heart. So does anybody have any questions for me? All right, thank you.
Hi, well, I've already been introduced. My name's Adam Richards, but I had the opportunity to be present at work this day, which doesn't always happen. I'm sometimes on vacation, as it always goes, that somebody's missing. But I was sitting in my office, and I think, like many of us, received some unofficial communication that something was going on. And at the end of that phone call, I said, this isn't a drill, right? Because I just wanted to make sure. This seems like a lot of, this is a pretty impactful statement to make, to kind of start ramping people up in this way. So the person said, no, this isn't a drill. So we got notified right around 10:25, which I think we look back, and the initial kind of notification was around 10 after the hour. So still, although better than in the past, still a little bit of a delay for notifying the hospitals getting ramped up. But in this situation, what I like to point out is that we had time to react. This was at Freeman, which isn't like at LC, which is right next door downtown. We had some time before all these events were going to transpire. So we had a little bit of time to react. You know, I immediately went from my office to 2 offices down to my staffing for the ER and said, call everybody now. And the question for us became, well, what do we tell them? And I pretty much told her, I can't remember exactly, but something like, I don't care what you tell them to get here now. Because the initial phone call was no more than, this event's going on, we have a shooting at a school. How many are hurt? We don't know. So we were operating off of a lot of assumptions. And for us, it was thinking worst case scenario. So we called everybody. And we got quite a few people. I was pretty happy to see the response. And I think throughout the city, hearing of other hospitals' responses, I think we had the same effect. People came, people showed up. So some of the questions we had, we immediately rolled out to my physicians. I went out to the charge nurse desk and pulled the docs over and said, hey, this is what's going on. And one of my doctors looked at me and said, yeah, I already know. I read it on Spokane News. I'm like, well, how come nobody called me? So somebody did eventually. But yeah, they were getting there, as we all know, off of social media. They get the notifications. So we started to prepare. And not knowing the quantity of what was going to happen, you know, this is a big impact event, but how many are hurt? How many docs do we need? How many ORs do we need to free up? We didn't know. We had no idea. The initial reports were it was only a few people, but knowing how these situations unfold, we thought it was going to be a few people every 15 minutes or a few more and then a few more. So we didn't know what to prepare for. So we ramped up with everything. And as you can see from this timeline, initially we chose not to activate an external triage and activate an emergency. I immediately ran up to our C-suite and we pulled together a team. We had incident command set up right away within 5 minutes probably. I think Daryl got the text. I knew he was off site, but I need you here now. And so we could set up incident command. So we immediately set up incident command, not knowing how many patients there were going to be. We didn't activate our EOP per se, although we basically did by doing all this stuff. And we received our first patient at about 30 minutes after we got the initial notification. So that gave us a pretty good amount of time to set up. We set up all of our trauma rooms. We had staff. We actually were able to pull people. Coincidentally, we had a class going on next door that had about 15 extra staff. So we pulled all of those staff out of class, and which actually contained all of our trauma coordinators were there too. So we pulled 15 to 20 staff immediately, ER staff, directly into the ED. It was great timing for us to have that. And so we received all 3 patients by 11:15, so about 45 minutes after our initial notification. And again, much like Erica said, the reports were all over the place. We have the HEAR radio, but we were only using it in the city. We did an initial, Erica at the DMCC did an initial notification out to the city, but we didn't have any communication with EMS. Even Mike Lopez, who was on scene at Sacred Heart, had a difficult time figuring out how many patients are there. We also got the notification that there were possibly multiple shooters, multiple locations. So the rumor mill was flying with misinformation, which made it really difficult to know how were we supposed to respond. Things that we considered, we knew immediately. I think it was an initial, you know, with knowing that it was a school, we said we have to prepare for families. We know there's going to be a lot of families, the whole school is going to be here in about a half an hour. So that was immediately one of the priorities. As I was working through the ED patients, the incident command was working through putting together the family plan for how are we going to receive all these folks. So Sacred Heart set up a family receiving center right in the clubhouse, which is directly above in that beautiful red area in the picture, where people could walk in, and as soon as they identified themselves as part of this event, they were taken up to this receiving area where they could be kept with other families. And then as appropriate, all the families actually arrived with the ambulances of the patients. So as they arrived, they went right with their loved ones, but we also allowed all the other family members, extended family, friends that came to get up to this other area because we knew we were receiving all of them. We also, I think, what worked out really well in this situation, because there was 3 and not more than 3, but there were 3 different law enforcement agencies present for this investigation. All of them were at the hospital: State Patrol, Sheriff's Office, City Police. All of them were crawling all over the ED. This was a huge investigation. Keeping them all in one location actually worked really well. I don't think in a situation with more than 3, it could be a little bit different. Sacred Heart was ready for about 8 critically injured that day, but because these weren't critically injured, the 3 number didn't seem too bad. And but keeping them all together actually, I think, helped facilitate better investigation, or at least allowed them all to be in one location, which isn't always how we decide to do it. When you're distributing patients throughout the town, you need to kind of do one here, one here, one here. In this case, because they were pediatric, it actually worked out really well to keep them all at one location. I think it was unintended, but it worked out really well in this situation. I think that's about all my time. So we had a lot of ORs ready. I think a lot of people throughout the city had that same experience. But do we do questions now or at the end? Probably. Any questions immediately for me?
So I'm going to stay seated. I had the opportunity to visit our hospital and be a patient and have a little hip surgery. So I've got a little hitch in my giddy up for a few weeks. But to touch on Simone's point, and Erica touched on it as well, I suspect many of us had family members that had children at Freeman. And just something that I wanted to share, I was actually going to wait until the end, but I'll share it now because I think it ties in nicely. When we moved here 13 years ago now, we moved into the Freeman community, and that was our home up until this summer when we moved away. Our youngest son is 9th grader, and so knew all the kids. And as Adam was texting me, and you know, I was actually over at St. Luke's, the generator scenario that Nancy talked about. We had some lingering issues that I was dealing with over there. And so I was over at St. Luke's when this happened, and Adam was texting me. And as I was coming back, and right when I arrived at the command center, my wife had texted me, and she says, Emma is one of the children that are hurt. And, you know, it's just, it's interesting how impactful that can be. And I share that on a very personal and very emotional level. Simone touched on that, but I want us all to be aware of that. Especially with the active shooter scenarios in the, you know, hopefully event that never happens in one of our own facilities. But sadly, in healthcare, statistics do show us that it is likely to happen. So think about that. I think impact individually and more importantly on staff. So as I'm going to try to touch on all the non-clinical type response, we did have an awful lot of staff available, and I think that was really helpful. And I'll try to tie in several different things, but those initial alerts and warnings, how you get them, you know, all first information, second and third information oftentimes is wrong. And so you're trying to process that and prioritize what is accurate and what isn't. And, you know, in this type of scenario and many, it's often better to be more prepared than you actually need to be. And I think fortunately for this incident, we were, but still the impact on the hospital from the family members, I think there was an awful lot of lessons that we learned. Internally, you know, we had some misses as well. Our clinics and urgent cares were ramping up and trying to prepare, and it wasn't something that I was thinking about at the time, and we should have done a little bit better job communicating with them. Holy Family had done a lot of preparations to ensure that, you know, if we needed to offload some patients from Sacred Heart and send them up there, or if there was additional patients, was doing some preparation. And then as the family members started to arrive, we had 2 patients arrive almost simultaneously, and then the third, but then the family members came. And for any of you that have ever been to Sacred Heart, one of our biggest challenges is parking. It's horrific around the campus. And so where do you suppose we parked people that came to this incident, the family members? It just kind of happened, and I think I'd do it again in a planned event, but they all just parked on 8th Avenue. The police department didn't really love that, but I'm not sure where I would have put them. We don't really have a good spot, so that was something that you know, we need to think through, and I think everybody does, especially from a hospital standpoint for scenarios like this. And then, so what are the family needs? And I'll get into this a little bit more. Adam touched on it, but you know, who all needs to be out there to help? Certainly, we need the clinical expertise. We need chaplains. We've got a lot of those. We're really blessed, as is Shriners Hospital, with child life specialists, which they're just an amazing skill set of people people that can relate to kids and relate to the clinicians. And so we were able to have each patient got assigned a child life specialist along with the clinician, along with essentially an administrator. And so that was just very helpful for us in this incident. So kind of touching on some of the family issues. So, you know, what's the definition of a family? You see it up here on the screen, but it's really broad. And I kind of first learned this in some fatality management planning that I've done through the community. But it's really, you know, anyone that's associated with that family. And you really have to be pretty open-minded to that. But I think we also need to be very sensitive to the actual family members, because many times, you know, a friend might not be welcome with that family. So how do you discern that can be challenging. In this instance, because of Freeman, which, you know, I know very well, and it was interesting the discussion we had around this, but as we started to prepare for the families and that night and expecting them to need some support for a couple of days, the question was, well, do we need 3 different areas? And that would probably be the natural thought. But actually there was a few of us that were thinking, no, I'll bet the families are probably going to want to just all be together. And so we talked to all 3 families individually, and sure enough, their decision was, nope, we're one family, we're one community, and that's the way we want, you know, that family reception center, family information center to be set up. So we talked through a couple of different locations for this ahead of time. Fortunately, one of our larger rooms that happened to be near the surgery area, because we're also spread out really far in Sacred Heart, worked very well. Catering supported it, housekeeping supported it, chaplaincies, social workers, a lot of other things. And so, you know, thinking about how you activate that, and again, I know most of this is more for the hospitals that are here that would have to deal with it, is something that I didn't have clearly worked out. But fortunately, we've got just some amazingly experienced people within Providence, and it all worked very well. But it wasn't you know, a well-oiled plan ahead of time. But thinking through some of the other support services that you might need are actually, I'm not even sure who came up with this idea, but brought in cards and coloring material so that you know, letters and notes can be written for the children. And we had chaplains and others down there just supporting them and whatever the needs was, and of course coffee and food and these other things. But just thinking through those types of things, the whole psychological, social, spiritual, personal needs is not always intuitive. I think the Freeman situation was really, you know, kind of the perfect storm in a tragic type situation, because the community is just so small, as many of our rural communities are. It made it easier. And really at the end of that, I think we have to be really, really flexible, and we want to accommodate the family. So kind of funny story, the lady that was injured the worst, you know, was in surgery, but the other 2 got into rooms pretty quickly. We had one in our pediatric ICU and one in our pediatric wing. Pediatric ICU was pretty easy to kind of contain, and it's not a lot of commotion in there. The pediatric wing, and this happened to be Emma, who's a cheerleader, and, you know, everybody wanted to visit her, and, you know, it was just nonstop social hour as families and kids were coming up there, which was a little bit disruptive to the hospital environment, and something our charge nurse and the nursing staff had to, you know, continually monitor. But we were really trying to be open to the patient's needs and be supportive to what the family wanted. So I'll turn it over to Jan, I think, next, and then we can take questions at the end.
Okay. Hi, everyone. I'm Jan Dobbs, and I'm the Chief Operating Officer at Frontier Behavioral Health. Well, I was involved in the drafting of the Behavioral Health Disaster Response Plan for the Coalition. And I had just updated that plan not more than a month ago or so. So I was very familiar with it. So when one of my staff contacted me and said, hey, there's been a shooting at Freeman, I knew exactly what was supposed to happen. So I contacted the Spokane County Regional Behavioral Health Organization, or the BHO, and I said, heads up, there's been a shooting at Freeman. You're probably going to be getting a call from the coalition to activate our network. so that we can respond if needed. So we all waited for that call, and instead what I got was Travis calling me saying, "Did you hear there was a shooting?" And I said, "Yeah, and we're ready, we're waiting." Well, the next call I received was from the Empire Health Foundation, asking me if we could gather staff together to come to Freeman to provide support. And they weren't sure quite what they wanted us to do, and they weren't sure how many of us they needed, but they wanted us on site. So at that point, I contacted Travis and I said, "Travis, are we not doing this plan?" And I said, because I've been contacted by the Empire Health Foundation, and I'm not quite sure how to respond to this. And through our conversation, the ultimate decision was, well, I guess we're kind of a free agent here, and we're going to help in any way that we can. I don't think that our experience at Frontier Behavioral Health was different than a lot of the other mental health providers in our community. I think that we all, because we understood the gravity of the situation, when we all got that call from Empire Health Foundation, we all showed up. I saw the night after the day after the incident, we were at Freeman at 5:30 that night because the superintendent was going to address the family and friends and faculty of Freeman. And I saw in that audience Lutheran Community Services staff. I saw Children's Home Society staff, hospice staff. There were a lot of providers there, and we were all there because we got contacted in a way that we didn't anticipate, but we all showed up. And we were there that night to provide support, although I will honestly tell you what I said to my staff was, do whatever you need to do. If you see somebody who's hurting, if you see somebody who has a question, talk with them. Try to provide educational information, try to provide support, but our presence alone may be helpful to people to know that we're there if needed. So that was our first foray into responding to this incident. Then the next request that came to me came from ESD 101. There had been a shift where now Empire Health Foundation was not calling providers, but ESD 101 was. When we were contacted by them, again, they asked, can you send us some clinical staff to be here at our school? We'd like your staff to be in the classroom. And again, I asked, and what would you like us to do in the classroom? And they said, we just want you to be there. So once again, I'm gathering people and pulling them together and saying, hey, here's what we need to do. They want us in the classroom, not outside of the classroom. I don't know if they want you to identify if there's a student who has a need, or if a student comes up to you, then please, help them and try to do that in a private area. So we were in the classrooms, and we did that for a week. Then the next request that came was, now we don't think that we need you in the classroom, but could you just be there? Now, I don't know how much you know about mental health services, but the clinicians that we have, they see clients every single day, and they are booked out 30, 60 days in advance because they have individuals that they see weekly sometimes, or every other week, or what have you. So in order for us to do this, we had to clear schedules. And we didn't want to do that to the detriment of the clients that we see, because we knew that they needed our assistance, our ongoing assistance as well. So to say that we sent 30 people and then another 10 people, logistically, it is a challenge, because we want to continue to serve the population that we serve, but at the same time, we want to assist in this situation. Once we did that, then they asked us for that one staff person a day to just be there and be a resource. So things kind of started to settle down. First, we were present and trying to assist in any way we could. Then we were in the classroom trying to assist students and teachers. And then we were sitting outside with a resource table, say, we had brochures, we had information, and people would come to us if they wanted some type of assistance. Where we're at right now is that Freeman they received some type of assistance through the FBI for about 60 days where they could have mental health counseling on site. Well, that 60 days has come and gone. And so they have asked us, Providence actually contacted Frontier Behavioral Health and asked if we could enter into a conversation with Freeman about what kind of assistance we might be able to provide. So after Thanksgiving, we're going to meet with Freeman to find out what is your current need and what kinds of needs do you have, because they have teachers that have not taken a day off because they want to be there for the students. And they have teachers that are really traumatized by what occurred, as well as students. So we're going to go out there and have that conversation with them about what can we do to help and what do you think your need is, and then we'll kind of go from there, because they're concerned about the summer, what happens to these kids and to their staff when summer hits. Can they get help? Where should they be getting help? They also are anticipating some difficulties as they get closer to the month of April, when there is supposed to be a trial. And the staff and the students are still trying to recover from this traumatic event. A lot of them have some symptoms of PTSD, and they are now looking at April as another time when all of this will just be dredged up again. So that's where we're at right now, trying to see in what way can we be of help, and we absolutely will include our other mental health and substance partners if that's appropriate.
Thank you, Jan. I'd like to add one thing, and because it's probably, you were probably curious, why was it ESD 101? Why was it Frontier Behavior Health? Everyone was asking those questions. It was pretty chaotic. I'll be quite honest, and we all have discussed that. We would have liked more structure. They tried to give it structure, and it was very difficult. The woman who was calling from ESD 101 is actually a counselor with ESD 101, and she was just designated, hey, can you be responsible? Another person from Empire Behavior Health, can you keep track of all the counselors? Fortunately, Daryl's wife, Susan, very efficient, and she actually kept a whole schedule. She kept all the vetting of all the counselors that came, and she did tremendous work. My point is, this all could have been better, more easily organized if your plan, the behavioral health plan, could have been implemented. And we're all working, especially Travis and I and Chandra, on how can we do this better in the future. The reason I asked you if this was about, I didn't ask you, I wanted to ask you, was this a major emergency or disaster? Yes, but people did not think so. And I will be quite honest, when I showed up at Freeman High School, law enforcement asked me, what are you doing here? Why is emergency management here? They didn't even imagine when I explained the behavioral health need and how desperate this school was and how tight a community, it's almost going to make me cry. Wonderful people and how much help they needed. It was phenomenal, and nobody understood that on the outside. And so all of us who were just trying to help and do whatever we could, I pretty much was helping the superintendent. That was my primary function, to be his right hand, follow up on this, follow up on this, follow up on this. I mean, hundreds of calls, hundreds, and I'm not I'm not kidding, hundreds and hundreds of emails every single day. And he'd just send them to me, respond to this, respond to this. I mean, it was huge. And law enforcement, yes, and someone else said that. 1 fatality, 3 injured has nothing to do with behavior health response or feeling. That doesn't matter how many, 1 or 10. Yeah, it's going to be impact independent or individually greater the more fatalities. But I visually and I experienced how strong the emotional response was and the challenges. So I really hope we can make sure we get you involved better, faster. Chandra's our deputy director. Sorry, I'm saying Chandra, and you may all not know who she is. Our new deputy director. She'd been in the position 4 months when Freeman happened. And I think she was hesitant. I was hesitant. You know, when people are taking the lead that don't usually take the lead, we struggle with that. But we're working with law enforcement, fire, saying, hey, why weren't we contacted and brought there immediately? Why didn't you guys see that? Why didn't you see that this is a huge deal, an active shooter? They know that. They know that. So I'm hoping we can do better in the future. I trust we can, because we've got a lot of good things we're working on. Any questions for anyone here? Or yes, Dr. Nuya.
It opened up and invited all the potential people, stakeholders of interest, that the extent of the problem, the areas where there were problems could have been addressed, and there could have been networking.
Yes, I do. I personally, I'm going to speak for myself personally. We were thrown in a difficult situation because we're used to having law enforcement, fire saying, hey, this is a multi-jurisdictional situation. We need emergency management. Why I said to you earlier that Freeman is a jurisdiction, they hadn't looked at it that way. And so nobody had looked at it as Freeman's going to need this. And I think if we could have been involved right away, I mean, I asked this question, what would we have done? We would have had a meeting that night, and we would have brought at least unified command together, which would have meant Healthcare Coalition, Spokane Regional Health District, law, fire, ourselves, and hopefully, you know, depending on our connection, hopefully is stronger now, hopefully will be with Lutheran and Frontier. Maybe all of those could have come together that night. To me, that is an ECC, but it's not the official ECC at the Fire Training Center, where our office, our ECC, our Emergency Coordination Center or Emergency Operations Center is. But you can still make an ECC at the location. So we're struggling with this. You know, Dr. Nia also is at the Fire Training Center, and it's a really good question. People didn't see that this was a multi-agency response. But if you look at the behavioral health need, yes, it's multi-agency. And we're going to have to do some education around that. I saw that. That was clear to me. There's going to need to be more education. And I'm happy that Tiffany and Travis will be talking with Chandra about that some more. And some of it is going to be around, okay, behavioral health is one complex issue, but it's multi-agency. And I think that's hopefully going to improve if we look at it at a different way than we have traditionally.
I would also say if you look at some of the recent events that we've established the ECC, when we had Windstorm or the House of Charity incident, how that multi-agency networking benefited the situation, helped everybody kind of wrap their heads around what needed to be done. So, you know, I think initially looking at this event, small number of people, it actually, if you look back now, it was a large number of people. It was a big event, a big deal. And maybe the initial outset didn't look like that, but looking at it retrospectively, I think we could have handled it much the same way that these other events were handled.
Very well said. There was another question.
Yeah.
Hi.
My name is Cletus Nanabu, and I'm the program director for the Crime Victims Camp program, statewide program, and I flew in from Olympia to attend to this meeting.
Great.
And thank you for the action you guys took in relationship to the Freeman. When I heard you say that the response people didn't look at that as an emergency, I don't think they were looking at all the kids that were in that school,
Yes.
or the kids in the middle school, or the kids in the elementary school. So basically, the reason why we're here is to encourage you as you deliberate or as you begin to put your plan to put in place what happens a week after the incident, a month after the incident, a year down the road after the incident, because we know what's going to happen. You mentioned April. We also know that something is going to happen a year from now at the anniversary date.
Yes.
So Crime Victims is set up there to take care of, provide both mental health and medical treatment to the victims. In fact, what we did was we opened it up to all the students that were in Freeman.
Oh, thank you.
Cover.
I was not aware of that. Thank you. He mentioned that all the students, when I was there, that was not the case. It was only going to be for the high school. So I'm happy to hear that, because I saw a lot of that, you know, especially in that first week. All the schools and the teachers and the parents all needed support. So thank you. Thank you for saying that.
I'm going to go next. I'm Mary Soderquist. I too flew in, not with Cletus, but I'm from Olympia, and I'm with the Office of Crime Victims Advocacy. We are on the victim assistance side. He's on the compensation side. We're the ones who work with Lutheran Community Services, and we help provide them with funding. When you're talking about, and thank you, Simone, I heard you, and it's loud and clear, that everybody, and those who had families and students or friends that were in the school, were affected. And that's how we look at it when we're looking at individuals who have been impacted and hurt and harmed by crime. And so there's the primary, the secondary, and can be as far as the tertiaries that are impacted. I don't use these, sorry. But what we do at the Office of Crime Victims Advocacy is also to help assistance in providing. Right now, I'm in the process of working with the Burlington Cascade Mall shooting. I was the one who worked with the Marysville Pilchuck High School. And so there's opportunities, and I heard behavioral health. Is it Frontier? Okay. How are we going to serve all these people? Lutheran Community Services are aware there is an anti-emergency assistance program. And there's things that we can look at in how to get grant funding and how to move this forward, because we're not talking about a year from now, because I'd like to change the narrative. We don't have anniversaries except with celebrations and happiness. Talk about it as a remembrance, and that's just one thing I'm going to leave with you today about that. It's not a remembrance that's going to happen next year. I mean, it's going to be a remembrance. It's not an anniversary. But we're looking at changing the narrative and the lens and how we look at these. It's a big impact for individuals. We have opportunities, so I understand you can connect me with, I guess, the gentleman in the blue, and I'd also like to connect with a couple others, because I can see how we can come together and determine. And one of the things that for first responders, for healthcare providers, for victim service providers, prosecutors, I know they may not be here, law enforcement, or emergency managers or planners, as well as us at the Office of Crime Victims Advocacy. There's a mass violence toolkit out there. It can help you develop protocols and procedures and how to bring your communities together and plan for future incidents, because you already know it's not if, it's already happened. And we have a number of them here in this state alone. So I want to connect with all of those that I can connect with.
I'll
So
give you my card. Thank you, Mary.
thank you, Simone, for recognizing the impact.
Thank you. In our major after-action review with first responders, I will say that we got wonderful support from Fairchild, and they are wanting to do an active shooter exercise and really bring in more people. They see how much of a need that is. So we're going to be working with them on doing that, and hopefully doing more of those with the schools and all of our partners. I also wanted to say that the Crisis Management Institute, it really was one person, Sherry Louvre, I think is how her name is said. She has worked a lot with the superintendent and staff to make them aware of some of these dates that are going to be challenging for the school. So, and the school psychologist and the school counselors, I believe, are going to be in touch with Lutheran about some of these issues that are going to be coming up. So I'm hoping with Frontier and that they will do that. But at the time when I was there, that was their goal. So any other questions? I thought there was one more over here somewhere.
So I have a statement and then followed by a question. My first statement is, God bless you, Jan, and thank you very much. Jan kind of downplayed her role. She said she helped draft the behavioral health response plan. Jan wrote it, and she asked for input. She made it better. She's updated it. So thank you for that. It may not have worked the way that you planned, but obviously there's a lot of thought that supported this exercise, and it's exciting to hear that we're going to have the opportunity to make it better. My second, I guess my question to all of you, as you look at the timeline and the responses that took place, I was in Davenport and my nurse was in communication with her nurse at a Spokane hospital getting feedback over social media that we had 6 fatalities and 20 injuries. And so obviously we all know social media plays into these types of responses, and usually we hear about them from inappropriate avenues. How do you work to create and support your response with credible information that you can share with your staff versus the social media that they're going to be impacted from?
I could say that's a very, very good question because I wrote it down earlier. Like, how are we going to do better to get you all accurate information? You want to answer? Because there's a little talk about that, how to do better, 800 megahertz.
Yeah, I think one of the solutions is a unified radio frequency that we can all share. So looking at what the county is using for direct communication with hospitals. There's the HEAR radio, but it's short distance. The 800 megahertz system is a little bit stronger, more robust, and encrypted, so private. So that's probably one of the first solutions to bridge the gap between EMS and the hospitals. Frankly, once we got started, I didn't have time to look at social media. I think the marketing department might have paid more attention to it, but we didn't. I lost track of what was going on beyond that initial alert, and my focus was then on patients and operations. So we got misinformation, as Erica had stated, from people who are out on scene, first responders with bad information or with guesses and rumors. So.
Yeah, I'd say I don't think there is a simple answer, but certainly we have to continue to focus on establishing processes and equipment that will help get us the right information. But I don't think we're ever going to get away from rumors, and certainly social media. And all of that helps. I mean, it helps paint the picture. Some of it's wrong, some of it's right, and how do you discern that? The other thing I guess I want to close with and comment on again is you can't really overlook the impact of this incident on the community. In particular, from the superintendent to the principals to the staff who all had kids there. I mean, they were profoundly impacted, and yet they were trying to respond. And what's the right answer? I don't know. It's their jurisdiction. I mean, they have to be involved. My wife and I have been having this debate, and she's like, we need to, get a neighboring school district that can come alongside and take over incident command. And that's nice in theory, but, I'm not sure if that is going to work that well. The other thing that compounded it, which is not unique to many of the small rural communities, is, the Freeman School District is a school district made up of an elementary school, a middle school, and a high school. They all sit on the same campus. You know, the larger schools do have a few more resources, but it's certainly not unique to them. So that personal, emotional impact that Simone touched on at the beginning, when something like this happens, and sadly, I believe it's going to happen again in our community. I think we need to continue to talk about this and try to figure out how to come alongside and support and develop processes and systems so that we can do better. But we've got great people in the area and great relationships, and so I think that's usually our strength that helps us.
I'm in support with Adam and Daryl. I know we've talked about the 800 radios for quite some time now. I think one other thing that we can do is just continue exercising and reinforcing the use of the tools that we do have so that we have all necessary members participating in communication and so that we're getting information from the right individuals. Watch rack.
Thank you. I'm Erin from the Spokane Crime Victim Service Center at Lutheran Community Services, and I'm new to this meeting. And so just a couple of, it's really the same question about two different issues. Being new to this process, what happens now that we know the lessons learned around mitigating the personal and emotional response to a mass violence incident and how it affects not just the people at the site, but the people at the responding organizations who might have personal connections? There's going to be a plan to incorporate that, as well as how we connect students, faculty, staff, witnesses with long-term resources.
That's a really good question too. I'm an employee with the county. I know the county got very involved in connecting with staff to see if anyone needed support from the Freeman, because we did have some staff who had kids there. So no, I think it's a discussion we should have again, and probably with Jan. I would recommend having all of us come together and meet with Chandra and myself, because I was at Freeman. I think it would be important, and discuss it, because I'm not sure of that answer, quite honestly. It's a good question. Anyone else have a thought on that? Heidi, yes.
Hi, I'm Heidi. I'm from Lutheran Community Services, and I've been out there doing mental health therapy since week 2. And one of the things I've been really trying to work on is connecting people to resources to get counseling. And there are a lot of barriers beyond just the funding, but the staff at the high school have to start with L&I. And that in and of itself is a challenge, because only psychiatrists, psychologists, or psychiatric ARMPs can provide services through L&I. And that's a hoop they have to jump through then to their insurance. Fortunately, Kaiser Permanente, who's the main insurer for the staff, have decided that they will cover it even with the L&I claims being made. But then you have CBC as a secondary payer after the insurance. And then you have the issue of providers being willing to register for CBC in the community. So if they don't have Medicaid, the majority of them are going to be having to see a private clinician in the community, not going to an agency such as Lutheran or Frontier. So there's been a lot of hoop jumping for these people who are traumatized, and they just want to see somebody and have their needs met, you know, a little bit more quickly. So that's one of the things I think as you guys go forward in planning to consider too, is how you can come together to support people in getting help walking through those hoops, especially if it's a workplace thing, because there's an additional L&I hoop. So that's just something I wanted to add to your discussion for future.
I think the one additional comment to kind of both questions I'd add is I think the work that the Healthcare Coalition and emergency management's doing to capture these in the after action will help us in the future and help us do better and truly learn from it. But I think the reality is it's going to be challenging because there's just so many organizations, even in a community like this, that's not that big. But there's also some discussions between higher ed and like ESD 101 and Spokane Public Schools to get the counselors together and school psychologists and others to try to support really the efforts that were identified as lessons learned in this. And so the challenge will be just kind of pulling all of that information and getting it to the right people, Jan and the Healthcare Coalition and Emergency Management.
Well, thank you very much, panelists. I think that was a great conversation. I think the one piece that I might add on, is, which kind of reaffirms with some of the things that they said, is Freeman is somewhat of a rural community, although it's close to Metro Spokane. We have seen not this incident, but a lot of incidents in rural communities where if you're familiar with the rural community, you know everybody. The EMTs know everybody. The hospital staff knows everybody. So any incident like this does truly impact the entire community. And in some cases, we have had a community lose half of their EMS staff because of the death of a child they lost on scene, and they couldn't take it anymore. And they lost some of their hospital staff too for the same reason. So the other piece that we can't leave out of this mental health concept is taking care of those first responders as well.